Hello everyone, this side Dr. Abhijit, and today we are going to discuss about the septal development in cardiovascular embryology. So let's start. Now you already know that yes, we have a common atrium. Yeah, we have a common atrium in the beginning, right? So yes, the roof of the atrium, the roof of the atrium will give rise to a structure that is called as the septum primum. It is just in the midline. Yes, this will give rise to a structure that is called as the septum primum. So we are discussing the interarterial septum right now. Yes, we are discussing about the interarterial septum. Now, interarterial septum, you already know in the midline, yes, we also have this endocardial cushion, right? We also have this endocardial cushion. I have already told you this endocardial cushion it is coming from the cardiac jelly, right? It is derived from cardiac jelly. Which is a part of splanchnopluric lateral plate mesoderm, right? This cardiac jelly, it is coming from splanchnopluric lateral plate mesoderm. So we have already discussed about this, right? We have already discussed about this, the endocardial cushion, right? So let us suppose this part will be the future right atrium, right? It will develop into the future right atrium and this will develop into the future left atrium, right? So now the septum primum, which is coming on the roof of this atrium, it is going towards the endocardial cushion and it will lead to a formation of an opening over here, right? There will be an opening over here, and this opening between the septum primum and the endocardial cushion, it is called as the foramen primum. It is called as the foramen primum. So it is also called as the ostium primum. It is also called as the ostium primum, right? So ostium means the opening, right? Ostium means the opening. So now what will happen? This septum primum, this septum primum will move down, and it will attach to the endocardial cushion. It will attach to the endocardial cushion. Now let us just draw this and understand. Yes, let us suppose this is, yeah, now what will happen? This is the, let us suppose this is the endocardial cushion, and this septum primum now has attached to this endocardial cushion, right? It has attached to this endocardial cushion. This is nothing but, this is the septum primum only. So this is the septum primum. Now it is creating a opening in the above region, right? There is an opening which you can see over here. Yes, this opening, right? This opening. So this septum primum came down and it attaches to the endocardial cushion and it created an opening on the roof part, right? Let us suppose this is the roof part of the atrium, right? So this opening will be called as the foramen secundum. देखो foramen primum पहली opening तो हो गई, right? अब ये दूसरी opening बन रही है तो इसको second opening या फिर we will call it as foramen secundum, right? So foramen secundum, it is also called as the ostium secundum, right? Ostium means opening, so it is also called as the ostium secundum, right? So yeah. Now after that, what will happen? Another septum will develop on the roof. Another septum will develop on the roof, which will partially cover this septum primum. Let us just try to draw this. Now let us suppose this is the So this is the roof, right? This is the roof, and over here we have this endocardial cushion. So yes, this is the endocardial cushion. Now what will happen? Yeah, the endocardial cushion, it is basically attached to the septum primum, right? It is the septum primum, septum primum. Now again there will be a septum which will grow on the walls, okay, on the roof part, right? And this septum which is growing right now, it is called as the septum, yes, it is called as the septum secundum, right? It is the second septum which is growing, so it is called as the septum secundum. It is called as the septum secundum. Now what it will do, it will partially overlap, okay, it will partially overlap the septum primum, partially overlap the septum primum. Now there will be an opening which will be present, okay, in between these two, and this is given a special name, right? This particular opening I'm talking about. Now this is called as, this opening, it is called as the foramen ovale. It is called as the foramen ovale. So remember, the septum primum, it is thin and mobile, okay, it is thin and mobile, right, and it is like flexible, okay, I can say it is flexible. It is actually acting like a valve, right? It is acting like a valve, okay. So yes, whereas the septums, see, if the blood will increase in this region, if it will increase in this region, what it will do, it will try to go through this foramen ovale. So yeah, it will push this septum primum so that all the blood can go from this area to this area, right? So it is just acting like a valve, right? Septum secundum, it is basically thick and firm, okay, it is thick and firm, right? Now if we talk about the fossa ovalis, okay, or the foramen ovale. Now foramen ovale, basically the floor, it is formed by, you can see this floor, it is formed by the septum primum, right? Okay, the floor, it is formed by the septum primum, and the limbus, it is formed by the septum secundum. Septum secundum, right? So this was about the foramen ovale. Now coming on to the anomalies over here. Now defects. The very first defect, it is the probe patency of foramen ovale. Now when I say probe patency of foramen ovale, so it clearly means that there is incomplete fusion of septum primum and septum secundum. It refers to incomplete fusion of septum primum and septum secundum, right? And coming on to the next defect, that is the atrial septal defect. Atrial septal defect. Now the most common cause, the most common reason, okay, the most common reason, it could be the failure of septum primum to this endocardial cushion. If the septum primum, it is not like fused to this endocardial cushion, it can result in the atrial septal defect. So the most common reason, it is the failure of, okay, it is the failure of septum primum to, okay, failure of septum primum to fuse with endocardial cushion. Endocardial cushion, okay, it is also called as the AV cushion, right? Atrioventricular cushion, right? So it is the atrial septal defect. It can have multiple reasons as well. So atrial septal defect can be due to non-formation. Okay, it can be due to non-formation of septum primum, okay, or there could be non-formation of septum secundum. Or there is non-propatency of foramen ovale, okay, or there is opening, like the foramen ovale is not closed, okay, or I can say the patent foramen ovale, if it is still persisting, okay, or non-propatency of foramen ovale, this can also lead to the atrial septal defect. Now, let us suppose that both the atriums are like developing, and in between we have this endocardial cushion, right? This is, let us suppose, the endocardial cushion, right? And yes, we have the septum primum over here. So again the same structures, septum primum, right, and over here we have the septum secundum, right? Now you already know there is something which will open, okay, on the wall of this right atrium, right? You already know we have a structure that is called as the sinus venosus, right? The sinus venosus, okay. Now sinus venosus basically will give rise to a septum over here. This is called as the septum spurium, okay, it is called as the septum spurium, which is having two valves, okay, okay, just a lip like structure is there. It is called as the right venous valve, and we have the left venous valve. Now sinus venosus, basically it is opening on the posterior wall of the right atrium, right? You already know that. Let us just write this also. The sinus venosus, okay, the sinus venosus is opening on the right wall, okay, or I can simply say the right atrium. And which part of the right atrium? It is the posterior wall of the right atrium. Right? And yes, it has the right venous valve and the left venous valve. So the sinus venosus will have right and left venous valve, right? Basically they are joining together to form a septum, okay, forming a junction, and that junction, it is called as the septum spurium, okay, and this septum spurium, it is seen at the roof of the right atrium, right? So that was about the right and the left venous valve. Now coming on to the fate and absorption of sinus venosus. You already know the sinus venosus, we have already discussed in detail. So yes, the fate and absorption of sinus venosus, okay, the fate and absorption of the sinus venosus. You already know we have this left atrium, we have this right atrium, right, and we have the sinus venosus. You already know sinus venosus. No, it will be having the coronary sinus, okay, that is the left horn, okay, of the sinus venosus, okay. It will degrade and it will result to the formation of the coronary sinus that I have already discussed. We have this coronary sinus, right? So yes, let us suppose this is the coronary sinus. We also know that, let us suppose this is the sinus venosus, then you already know we have the formation of the inferior vena cava and we have the formation of the superior vena cava. We have the formation of superior vena cava, inferior vena cava, and the sinus venosus. They all are opening over here. Okay, they all are opening over here, and along with the sinus venosus, you know, we have this two valves, right? The right venous valve and the left venous valve. Right? So yes, this will, yeah. What will happen? This will be the superior vena cava. Okay, we have this coronary sinus, that is the left horn of the sinus venosus. Basically, it regresses due to the decreased blood supply, and this left horn remnant, it is called as the sinus, coronary sinus, right? And we have this inferior vena cava, right? Yes, and we have this rough anterior part. Okay, the rough anterior part. The interatrial septum will be there, and yes. So remember, this is the right atrium. Okay, this is the left atrium which will be formed. Over here we will have the interatrial septum, right? We will have the coronary sinus. We will have the coronary sinus, the inferior vena cava, okay, or sorry, superior vena cava and the inferior vena cava, right? Now this particular part which I am highlighting right now, this part will be the smooth posterior part, right? It will be the smooth posterior part, right? So yes, this will be the smooth, right? So this is the smooth posterior part, the one which I have highlighted with yellow color, right? It will be this also, yes, till over here, and this will be the rough anterior part, So right atrium will be having a smooth posterior part because of the sinus venosus and all the major veins that are opening into it, the superior vena cava, the inferior vena cava and the coronary sinus. So we have this rough anterior part, right? So yes, over here you have to just remember, okay, we have this right venous valve over here and the left venous valve. So the left venous valve basically it merges with the interatrial septum. So it merges with the interatrial septum. Even if you just want to remember the left atrium का भी posterior wall क्या होगा? It will be smooth, right? So remember the left atrium posterior wall will be, okay, by the absorption of pulmonary veins, and pulmonary veins are like 4 in number, right? They are coming from 2 from the right lung and 2 from the left lung. So it is by the absorption of pulmonary veins, Now coming on to the interventricular septum. Yes, coming on to the interventricular septum. Now we already know the bulbous cordis, right? So yes, let us just draw a diagram and understand this. Yes. So you already remember the topmost part, okay? The topmost part, it is called as the truncus arteriosus, right? It is called as the truncus arteriosus. Now this truncus arteriosus, okay, it will give rise to the aorta, right? Okay. So it will give rise to aorta and also the pulmonary trunk, right? And also the pulmonary trunk. Then we have this conus septum in between, right? The conus septum part. Now this conus septum, it is also called as, also known as bulbar septum, right? It is also known as the bulbar septum. Okay, it is derived from the neural crest cells, right? It is derived from the neural crest cells. Yes, over here we have this endocardial cushions, right? The endocardial cushions, and over here we will have this left atrium, right? So yeah, the atrium part, right? And this is nothing but the endocardial cushions. Endocardial cushions. Yes. Now this endocardial cushions will give rise to the membranous part of interventricular septum. So over here we will have the membranous part, of interventricular septum. Okay, so yes, and we will also have the muscular part of interventricular septum, the muscular part of the interventricular septum. It is basically coming from the cardiac muscles. Okay, it is coming from cardiac muscles. Cardiac muscles. So this is how the interventricular septum will be formed. So remember that, now this is the interventricular septum. Now remember that there is a spiral septum which is also developing, right? There is the spiral septum over here, right? We have the spiral septum which is developing in the truncus arteriosus, right? So this spiral septum, it is also coming from the neural crest cells, right? This spiral septum, it is also coming from the neural crest cells, right? It is actually dividing the upper part into like the one which will give rise to ascending aorta and the one which will give rise to the pulmonary trunk. So remember that the neural crest cells, basically they give rise to bulbar or conus septum, and apart from that they will also give rise to spiral septum also. Spiral septum also. So if you can see over here in this structure, this is the cross section. So yeah, in between you will have this spiral septum. Spiral septum. Yes. And this part of the truncus arteriosus will develop into pulmonary trunk, and this will develop into the aorta, okay, or I can say the ascending aorta. Ascending aorta. Now this spiral septum, it is also called as the aortic pulmonary septum because it is between the aorta and the pulmonary trunk. It is also known as the aortic pulmonary septum. Aortic pulmonary septum, right? So this is just have shown you a transverse section of truncus arteriosus in which you can see this. Now there is one condition that you have to remember. If there is anterior displacement of the septum, if there is anterior displacement of this septum, then it will lead to something which is called as teratology of Fallet, right? It will lead to teratology of Fallet, right? It will lead to teratology of Fallet. What will happen over here? Like this anterior septum has been, like it is like this, right? It has come in front. So this is the ascending aorta and this is the pulmonary trunk. Now there will be overriding of the aorta in both the chambers, right? So what will happen? The blood coming in the pulmonary trunk will be less. So it will lead to pulmonary stenosis also. We will have pulmonary stenosis, right? Blood coming to the pulmonary trunk is less. There will be overriding of aorta also. Overriding of aorta, okay. Aorta will be opening in both the chambers, okay. Aorta opening in both chambers. There could be right ventricle hypertrophy. That's why it is boot shaped, okay, classical boot shaped appearance. Because you already know the right ventricle, the pulmonary trunk, the blood is going less, right? So it has to exert more force, right? More pressure. So ultimately what will happen? There will be right ventricular hypertrophy also. Right ventricular hypertrophy, right? And there could be ventral septal defect also. Ventricular septal defect. Now ventricular septal defect, basically you know bulbar septum is there and there is like chances of shifting, okay, it anteriorly from the normal part, okay. So yes, that is like the ventricular septal defect. Yes, if there could be one more reason, okay, if like let us suppose that this is the ascending aorta and the pulmonary trunk. If there is non-spiral course of the septum, agar spiral course nahi hoga, so ascending aorta will receive blood from the right ventricle, pulmonary trunk will be receiving blood from the left ventricle. So this is called as the non-spiral course, okay, of spiral septum, and this will lead to transposition of great vessels. Transposition of great vessels. Okay, a recent case that was reported in the aeroplane where 5 doctors from AIIMS, they actually saved the child, okay. It went into distress and it was like he was coming from, I think, Hyderabad only after a major surgery of this particular condition, that is the transposition of great vessels. And yes, so suddenly in the flight, felt unconscious, and yes, we have the great doctors team from the AIIMS who saved his life with the minimum source available over there, okay. And there could be one more reason, beta, if the spiral septum is absent. If spiral septum is absent, now what will happen? There will be no spiral septum, ascending aorta, pulmonary trunk, the blood will be exchanged, right? The blood will be exchanged, and yes, in this case, basically, what can happen if the spiral septum is absent? It is coming from the neural crest cells. So there could be like the neural crest cells, they don't migrate. This could be the reason that why the spiral septum is not formed. So it will lead to patent ductus arteriosus. And this is something which is called, or which will lead to cyanosis, right? The mixing of the blood will be there, right? So that was about the applied anatomy over here. Thank you.